Hello, and welcome to the Vaccine Summer Series. This series is a collaboration between the Philadelphia Department of Public Health's Immunization Program and the School District of Philadelphia. My name is Jennifer Malins, a provider quality assurance nurse with the immunization program, and I am excited to present to you our fourth webinar in this series, Review of Live Vaccines. Today's agenda will cover how vaccines work, types of vaccines, review of live vaccines, diseases prevented by live vaccines, and interval spacing for live vaccines. How vaccines work. When germs invade the body, they attack and multiply. This invasion, called an infection, is what causes disease. The first time the body is infected with a certain germ, it can take several days for the immune system to make and use all the tools needed to fight the infection. After the infection, the immune system remembers what is learned about how to protect the body against that disease. Vaccines can help protect against certain diseases by imitating an infection. This type of imitation infection helps teach the immune system how to fight off a future infection. Types of vaccines. Scientists take many approaches to developing vaccines, depending on how the germs infect cells, the strain of a virus or bacteria, how the immune system responds, regions of the world where the vaccine would be used, and environmental conditions. There are five main types of vaccines that infants and young children receive in the U.S. The first category is live attenuated vaccines, and these will be the focus of this presentation. They contain a version of the living virus or bacteria that has been weakened so that it does not cause serious disease. Examples are MMR and Varicella. I will not go over the rest of the vaccine types in detail, but be aware there are non-live or inactivated vaccines, such as polio, toxoid vaccines, such as the diphtheria and tetanus toxoid components of DTaP, subunit vaccines, such as the pertussis component of DTaP, and conjugate vaccines, such as Hib. This is the 2023 recommended child and adolescent immunization schedule. If you look to the red circle, our live flu vaccine, MMR, and varicella vaccines will be the focus of this presentation. Rotavirus vaccines also are live vaccines, but they are not included as rotavirus does not affect entry into school. Children with invalid doses of MMR or varicella vaccines may be excluded from school until they receive a valid repeat dose. What is measles? Measles is a highly contagious virus that lives in the nose and throat of an infected person. If other people breathe the contaminated air or touch the infected surface and then touch their eyes, noses, or mouths, they can become infected. Measles virus can live for up to 2 hours in an airspace after an infected person leaves the area. And measles symptoms appear 7 to 14 days after contact with the virus and typically include high fever, cough, runny nose, and watery eyes. Measles rash appears 3 to 5 days after the first symptoms. So you can see how it is so easy to spread. Yes, it is a highly contagious virus, but also a person is infectious long before the telltale rash appears. And this is an example of the measles rash. Measles can be serious in all age groups. However, children younger than 5 years of age are more likely to suffer from measles complications. Common complications include ear infections and diarrhea. Severe complications include pneumonia and encephalitis. As many as 1 out of every 20 children with measles gets pneumonia, the most common cause of death from measles in young children. We have seen a resurgence of measles due to an increase in international travelers who get measles abroad and then further spread the virus in the U.S. communities that have pockets of unvaccinated people. If you look at the graph, the US saw a major jump in measles cases between 2018 to 2019, about 900 more. And then look at 2020 with the COVID-19 pandemic. It appears social distancing and masking made a difference in the spread of measles throughout the country. And we are slowly going back up again, with 16 cases reported this year as of June 8th. What is mumps? Mumps is a contagious disease caused by a virus. It spreads through direct contact with saliva or respiratory droplets from the mouth, nose, or throat. Has anyone seen mumps? The virus enters the bloodstream and spreads to multiple tissues throughout the body, such as the parotid gland seen here. And complications occur when these tissues become inflamed, resulting in conditions like pancreatitis, encephalitis, and meningitis. It can also cause deafness. What is rubella? Rubella, or German measles, is a contagious disease caused by a virus which spreads when an infected person coughs or sneezes. In children, rubella is usually mild, with a red rash on the face as the first sign. However, 25 to 50% of people do not develop a rash or have any symptoms, but they can still spread the virus to others. Rubella is no longer endemic in the US, but it remains a problem in other parts of the world. Less than 10 people in the US are diagnosed with rubella each year, and all cases since 2012 were infected when living or traveling outside the US. To maintain rubella elimination, it is important to be vaccinated. And you can see the definition of elimination does not mean zero. So continue to get vaccinated. This is the recommended schedule for MMR, our measles, mumps, rubella vaccine. For routine vaccination, it is a 2-dose series with the first at 12 to 15 months of age and the second between 4 to 6 years of age. Of note, both doses need to be administered before the child starts school. So if you like to give MMR when the patient turns 5 or 6 years old, make sure the child will not be entering school beforehand. For dose 1 in children aged 12 to 47 months, it is recommended to administer MMR and varicella vaccines separately. MMRV, the combination vaccine for MMR and varicella, may be used if parents or caregivers express a preference. And this is because there may be an increased risk for fever and therefore possibly febrile seizures in young children when they receive the MMRV vaccine. There also are special situations where additional doses of MMR vaccine may be warranted, such as for international travel or a mumps outbreak setting. But these may not count towards routine vaccination depending on the age of the patient. Refer to the immunization schedule for more information. These are the MMR vaccines in the United States. You may have patients from other countries who receive these antigens separately, but in the US, they are offered together. There are 2 vaccines that prevent measles, mumps, rubella only, the MMR2 and the Priorix vaccines, and there is one combination vaccine, MMRV or ProQuad, which prevents measles, mumps, rubella, and varicella or chickenpox. The MMR2 vaccine may be kept refrigerated or frozen. The Priorix vaccine must be kept refrigerated, and the MMRV vaccine must be kept frozen. If you see older patients who need to catch up on MMR and varicella vaccines, MMRV only is licensed through 12 years of age. And these vaccines all must be reconstituted with the diluent provided. What is varicella? Varicella, or chickenpox, is a highly contagious disease caused by the varicella zoster virus, or VZV, which is sometimes why you see the vaccine referred in this manner. It can cause an itchy, blister like rash that first appears on the chest, back, and face, and then spreads over the entire body. The virus can be spread from person to person through close contact, such as by direct contact with the rash, breathing in aerosols from the fluid of the skin lesions, and possibly through infected respiratory secretions. Serious complications include bacterial infections of the skin, infection of the lungs, infection or swelling of the brain, bleeding problems, and dehydration. This is the recommended schedule for varicella, and this should look very familiar as it is the same as MMR for routine vaccination. Routine vaccination is a two-dose series with the first at 12 to 15 months of age and the second between 4 to 6 years of age. And remember, both doses need to be administered before the child starts school. And a reminder, it is recommended patients receive MMR and varicella separately for their first dose. These are the varicella vaccines in the United States. Varivax is the trade name of the varicella vaccine. You may also hear it called VAR vaccine, VZV, or chickenpox vaccine. This vaccine must be kept frozen, and the guidelines for MMRV or ProQuad are the same. It must be kept frozen and is licensed only until 12 years of age. And both vaccines must be reconstituted with the diluent provided. What is influenza? Influenza, or flu, is a contagious respiratory illness caused by the influenza viruses that infect the nose, throat, and lungs. It can cause mild to severe illness and at times can lead to death. There are many flu viruses and they are always changing. The influenza A and B viruses that routinely spread in people are responsible for seasonal flu epidemics each year. There are influenza viruses that affect other species, and those sometimes cross into humans, if you remember the swine flu and the bird flu previous years. But we will be focusing on the human influenza viruses, the ones that spread through people, and these are spread primarily by respiratory droplets. Complications of flu include bacterial pneumonia, ear infections, sinus infections, and worsening of chronic medical conditions such as asthma and diabetes. And anyone can get flu, but some people are at higher risk of developing serious flu-related complications if they get sick. This includes people 65 years and older, people of any age with certain chronic medical conditions, pregnant people, and children younger than 5 years of age. So remember to promote our flu vaccine. About influenza vaccines. Each year, a new flu vaccine is made to protect against the influenza viruses believed to be likely to cause disease in the upcoming flu season. And even when the vaccine doesn't exactly match these viruses, it may still provide some protection. Preliminary estimates show that last season, people who were vaccinated against flu were about 40 to 70% less likely to be hospitalized because of flu illness or related complications. And we saw that children younger than 18 are more than twice as likely to develop a symptomatic flu virus infection compared to adults 65 and older. So this is another reason to promote our flu vaccine for children. This is the recommended schedule for flu. Use any influenza vaccine appropriate for the age and health status of the child, starting at 6 months of age. The inactivated injectable flu vaccine is licensed starting at 6 months of age. But our live flu vaccine, our flu mist, is licensed for non-pregnant people ages 2 to 49 years of age. Now, the number of doses can get tricky. Give 2 doses separated by at least 4 weeks for children ages 6 months to 8 years who have received fewer than 2 flu vaccine doses in the past. And if you happen to have a child who will be turning 9 between dose 1 and dose 2, they still would receive that second dose and receive 2 flu vaccines. And these 2 doses can be either our inactivated flu, our flu mist, or one of each. Any combination is fine. So you would give 1 dose for children ages 6 months to 8 years who have received at least 2 flu vaccine doses in the past. And you would give 1 dose for all persons aged 9 years or older. And that's including if they had not had any flu vaccine previously. And if you are using FluMist, make sure you check the patient's vaccine history to ensure no other live vaccines were given in the past 28 days. So these are the live flu vaccines in the United States. We have our LAIV4 or our FluMist. It's the only live influenza vaccine, and it is used to prevent strains of influenza A and B, and it is intranasal administration only. If you look at the photo in the bottom, you can see it's being administered into the patient's nostril, and this vaccine must be kept refrigerated, and it is licensed for non-pregnant patients 2 to 49 years of age. Live vaccines and the immune system. Live vaccines must replicate in order to induce an immune response. Several factors can interfere with replication, and these are a driving factor in the principles of timing and spacing of live vaccine. When administering live vaccines, administer on the same day or ensure there is a minimum interval of 28 days between doses. There is limited data available regarding interference between live vaccines, but research shows a person who received the Varicella vaccine within 28 days of receiving the MMR vaccine was 3 times more likely to have vaccine failure and come down with chickenpox. So this is why there is no grace period between the 28-day interval between live vaccines. So in conclusion, following the recommended vaccine intervals is important to ensure the patient has an optimal immune response. Administer live vaccines, so our MMR, our varicella, our Proquad, and our FluMist on the same day or at least 28 days apart. And remember, there is no grace period between the 28-day interval for live vaccines. And this is especially important if you use FluMist. Check the vaccine record and upcoming appointments to ensure other live vaccines were not given or are not scheduled. And I really want to point out the importance of checking the child's upcoming appointments, because let's say if they come to your flu clinic today to receive FluMist, but they are scheduled for a dose of MMR or varicella in 3 weeks, the vaccines they receive in 3 weeks' time will be considered invalid doses and they will have to be repeated. And if the child has an invalid dose of MMR or varicella, they may be excluded from school until they have a valid dose. So please be mindful of previous appointments and vaccines, as well as upcoming appointments and vaccines when using FluMist. Thank you for attending this webinar. If you have any questions about this webinar or the Vaccine Summer Series, you may email me at jennifer.malins@phila.gov. And remember to be on the lookout for the other webinars in this series. Thank you and have a great day.